Welcome back, knee enthusiasts, to another deep dive.
Into the world of knees.
In the fascinating world of knees, you got it. Don't forget to hit that like button, subscribe to our channel.
And ring that notification bell.
And ring that notification bell so you never miss a new deep dive.
You know, we love those knees, ready to geek out.
Absolutely, and today we're diving into a case study that really made me stop and think.
Interesting.
And I'm betting it will for you too.
Okay.
It's about a rare cause of loose bodies in the knee. Published in the Journal of Orthopedic Case Reports.
Nice.
Now, loose bodies themselves are pretty common.
Right.
But the origin of these little troublemakers is what makes this case so intriguing.
I'm listening.
We're talking about a 35-year-old man whose loose bodies turned out to be related to a previous surgery he'd had for a giant cell tumor, or GCT.
So a GCT, while it is benign, it's not cancerous.
Yeah.
But it can be locally aggressive, meaning it can grow and damage the surrounding bone. And this particular patient had his in the distal femur, which is the lower end of the thigh bone.
Okay.
A pretty typical spot for them to develop.
Right. And to remove the GCT, he'd had a procedure called extended curettage.
Okay.
So they basically scraped out the tumor and then filled the space with bone cement.
Like a cement?
Yeah.
Okay.
And he recovered well. Initially.
Which is what we typically see.
Right.
But TCPs can recur usually within the first 2 years and often at the original site.
And this is where it gets really interesting.
Okay.
This patient started having symptoms of loose bodies 4 years after his GCT surgery.
Oh, wow.
And the loose bodies were only in his knee joint.
What?
Not anywhere near the original tumor site in the femur.
So how did they get there?
Right.
That's so interesting.
So how did they end up in the knee?
Yeah.
Well, during the initial surgery, when they were scraping out the tumor, it's possible that some stray tumor cells might have spilled into the joint space.
Spilled over?
Yeah. Even with the most meticulous technique.
Right.
A few rogue cells can sometimes escape.
Those sneaky little cells.
I know.
Oh.
They set up camp in his knee joint and started multiplying.
Oh my goodness.
Eventually forming those loose bodies.
Wow. So this really highlights the importance of lavage during surgery.
Yes.
You know that rinsing process where they use sterile fluid to wash out the surgical area and remove any loose debris or stray cells?
It's so important.
Absolutely. Lavage is crucial in preventing recurrences and complications.
Yeah.
But this case also makes you wonder, you know, if there's even more we could be doing to ensure we get every last one of those stray cells.
It's like trying to catch every grain of sand on a windy beach.
I know, it's tough.
So they went in with an arthroscope to remove the loose bodies.
Yeah.
Like this. When they got in there, they noticed something very peculiar about their appearance.
Oh, fill me in.
They were described as nodular, grayish-black and firm. But when they cut them open, they had this vibrant red color.
Wow.
Not your typical loose body at all.
I'm guessing the histopathology, the microscopic examination of the tissue, confirmed what they were suspecting.
You bet the loose bodies turned out to be giant cell tumor? That's a pretty dramatic plot twist, right?
It really is. And it's just fascinating to me that even though the GCT was treated years earlier, it still managed to make its presence known in this unexpected way.
Yeah, you know, it's a reminder that as clinicians, we can't just focus on the immediate problem in front of us. We have to think about the bigger picture.
The whole picture.
Yeah, the patient's history, past surgeries, everything is potentially connected.
Absolutely. And in this case, the appearance of the loose bodies themselves provided some important clues.
Yeah.
They were described as nodular, grayish, black, and firm. Not your typical cartilage or bone fragment, right?
Right. And, I mean, as a radiologist, I'm used to looking for subtle signs in images.
Yeah.
But even without imaging, these loose bodies were visually distinct. Most loose bodies are smooth and whitish, but these had a unique color and texture, and that bright red color when they cut them open.
Oh, yeah.
That's a telltale sign of a highly vascular tumor.
It's almost like the loose bodies were waving a red flag saying, hey, take a closer look.
Exactly. It's a reminder that sometimes the answer is right there in front of us. We just need to pay attention to the details.
It's a detail.
Even with the best imaging, sometimes you need that histopathology to confirm the diagnosis.
It's the gold standard for a reason, and in this case, it revealed the presence of those characteristic giant cells, confirming that the loose bodies were indeed GCT.
Imagine if they just assumed these were typical loose bodies and hadn't done the biopsy. The GCT could have continued to grow within the joint, causing more damage.
Oh, yeah.
This case really emphasizes the importance of not making assumptions and always confirming our suspicions with the appropriate tests.
I think this case also highlights the need for clear communication and collaboration between different specialties. Radiologists play a crucial role in identifying and characterizing loose bodies, but it's the orthopedic surgeons who are ultimately removing them and managing the patient's care.
It's a team effort for sure, and when we work together, we can achieve the best possible outcomes for our patients.
For our patients.
Now let's talk a bit about the surgical approach they use in this case.
Okay.
Arthroscopy,
Arthroscopy.
a minimally invasive technique, right?
Absolutely. Arthroscopy has revolutionized the way we treat many knee conditions.
Yeah.
Instead of making a large incision, we insert a tiny camera and instruments through small incisions.
Right.
Less pain, faster recovery, fewer complications. I mean, think about how we used to do things. Open surgery was pretty much the only option for removing loose bodies.
Right. Technology has come a long way.
Yeah.
But in this case, the fact that the loose bodies were basically little tumors raised a dilemma about the best surgical approach.
Yeah.
Well, even with careful technique during the arthroscopic removal, there's always that concern about potential spillage of tumor cells into the joint states.
Yeah.
It's a valid concern.
Yeah.
Because it's tough to completely contain those cells during arthroscopy.
That's true. It is a consideration, and the authors of this case study actually raised the question of whether an open procedure where they make a larger incision for more direct visualization might have been a better option to minimize tumor spillage.
It's a tough call, right?
Mm.
Open surgery has a higher risk of complications like infection and stiffness.
Yeah.
But in this case, the potential benefits of minimizing tumor spillage might have outweighed those risks. Ultimately, the decision to use arthroscopy or open surgery depends on so many factors, like the specifics of the loose bodies, the surgeon's experience, and the patient's individual situation.
Couldn't agree more. And it's so important to have a thorough discussion with the patient, explaining the risks and benefits of each approach. Shared decision-making is key.
Absolutely. It's their knee, after all.
It is.
So in this case, they went with arthroscopy, and thankfully, the patient had an uneventful recovery and was free of recurrence for 2 years.
That's fantastic, but it does highlight the importance of close follow-up after GCT treatment. Even though the loose bodies were removed, there's always a risk of recurrence.
Right. Vigilance is key. Regular checkups, imaging studies, a watchful eye. It's all crucial to ensure that GCT doesn't come back. And empowering patients to be aware of any new symptoms is important too. Pain, swelling, limited range of motion, anything out of the ordinary.
Early detection is everything when it comes to managing GCT recurrences. This case really emphasizes that in orthopedics, we're not just treating knees, we're treating people. Each person has their own unique story and set of circumstances that we need to consider.
It's like each case is its own puzzle. We need to use all our knowledge and skills to put the pieces together. What I find particularly fascinating is the role of serendipity in medicine. It was pure chance that those loose bodies ended up in the knee joint. If they hadn't, who knows how long it would take to detect the GCT recurrence.
Right. Talk about a lucky break. It's like that saying, chance favors the prepared mind. We need to be open to the unexpected and ready to seize those moments when they present themselves.
It's a reminder that sometimes those unexpected findings lead to the most important discoveries. This case has definitely got me thinking about all the other unusual causes of loose bodies out there. I bet there's a whole world of weird and wonderful knee pathology just waiting to be discovered.
I think you're right, and that's what makes our work so exciting every day, is an opportunity to learn something new and challenge ourselves.
Speaking of learning, before we wrap up this deep dive, I want to leave our viewers with a thought-provoking question. Imagine you're a patient who has been told they have loose bodies in their knee. What questions would you ask your doctor? What factors would you consider when deciding on a treatment plan?
Great question. We encourage everyone to share their thoughts and insights in the comments below. And remember, whether you're a patient, a student, or a fellow knee enthusiast, there's always more to learn. So keep those questions coming.
This whole case, it really underscores the importance of lifelong learning in medicine. Even seasoned professionals like us can encounter cases that push us outside our comfort zones and make us rethink what we thought we knew.
It's so true. Medicine is constantly evolving. We have to stay curious, stay engaged, and stay up to date on the latest research. Otherwise, we risk getting stuck in our ways and missing out on important new insights.
This case has definitely been a reminder for me to stay humble.
Yeah.
It's easy to fall into the trap of thinking we've seen it all,
Right.
especially when you've been in practice for a while. But then a case like this comes along and shakes things up.
And I think that's one of the most exciting things about medicine. Wouldn't you say? There's always something new to learn, Always another challenge waiting around the corner.
Absolutely.
Right.
Now, I want to shift gears for a moment and talk about something that really struck me about this case. The diagnostic challenges involved in identifying loose bodies,
Yeah,
especially those with unusual presentations.
that's a great point. Imaging techniques like X-rays and MRIs are definitely helpful, but they don't always give us the whole picture. Sometimes the appearance of a loose body can be misleading.
Exactly. And that's why it's so important to consider the patient's history, conduct a thorough physical exam, and not rule anything out prematurely.
Absolutely.
And of course, histopathological examination of the removed tissue is crucial for a definitive diagnosis.
Couldn't agree more. It's like putting together a puzzle. You need all the pieces to see the complete picture, and sometimes the most important piece is the one you least expect.
Well said. So, for all of our listeners out there, whether you're a medical professional or simply a knee enthusiast, we hope this deep dive has given you a new appreciation for the complexities of loose body diagnosis and management. And remember, if you have any concerns about your own knee health, don't hesitate to consult with a qualified healthcare provider.
Absolutely. And as always, we want to thank you for joining us on the deep dive. Don't forget to like, subscribe, and hit that notification bell for more knee-tastic adventures. Until next time, keep those knees healthy and happy.